Welcome everyone. My name is Jessie Stahl and I'm the Senior Policy and Program Coordinator at PlantPure Communities, and I'm joining in today from Wilmington, North Carolina. We are delighted to have you all here for the webinar Nutrition and Health with Infectious Disease Specialist Dr. Saray Stancic. And now, before we hand things over to Jody, I would like to let the rest of the PPC staff briefly introduce themselves.
Thanks, Jessie. Hi, everyone. My name is Ella Stevens, and I am the Pod Support Programs Manager at PlantPure Communities, and I am joining in from the Netherlands.
Hey, everyone. My name is Caroline Dyer. I'm the Vice President, and I am joining in from Durham, North Carolina.
Hi, everyone. I am Jody Cass. I'm the Executive Director of PlantPure Communities. Welcome. I hail from New York. I'm actually on Long Island. I'm going to do a couple of quick introductions and set the context a little bit as well. PlantPure Communities is a 501c3 nonprofit organization. It was created by Nelson Campbell, who you'll hear from in just a moment. And our mission is to share the health message of plant-based nutrition and evidence-based science on plant-based nutrition and empower folks all over the globe to take steps to control their health and get healthier. We have several programs that we run. We have a pod network, which is global. We're in, I think, 25 countries, about 250,000 people. And they are folks who just are interested in learning more and taking care of their health. And they participate in these local support groups. And there's probably one near you, and we encourage you to take a look at our website and find them. Like I said, about 250,000 people. So we are very much interested in growing that. We also have the Oasis Jumpstart program where we work in underserved neighborhoods and communities of color to make sure folks are not left behind just because of their zip code or their socioeconomic status. And the Global Jumpstart that this is part of today is essentially connected to that Jumpstart program. I want to just give you a little bit of context. When the pandemic began earlier this spring, Dr. T. Colin Campbell wrote two very important commentaries about the link between nutrition and people's ability to fight the COVID-19 infection. Those are on our website, and we'll probably post them as well. But what we decided to do is to actually take our existing Oasis Jumpstart program and go global, and that's what this is part of today. And the idea being that we want to help people who want to take those steps to protect themselves and improve the quality of their health. So if you haven't already looked at Dr. Campbell's commentaries, I highly recommend that you do that. Again, it's on our website. The Global Jumpstart is really fabulous for anyone who wants to take steps towards improved health, but it's particularly good for folks who never tried it before, never tried to go plant-based, or have tried and failed. It's very, very supportive. It includes educational seminars, a workbook, recipes, cooking demos, interactive webinars, of which this is one of. And so if this is something, some folks who are on the webinar are already signed up, but if you're not, I definitely encourage you to take a look at it and join us. The kickoff is June 21st for the next one. PPC, we're also partnering with Dr. Michael Clapper, a medical doctor, on the Moving Medicine Forward initiative, and that'll be the subject of part of the seminar today. So with that, I turn it over to our fearless leader, Nelson Campbell, and our founder. Nelson, take it away.
Thank you, Jody. I would like to welcome our special guest today and provide a proper introduction here, and then going to hand this off to her, and then she'll provide an introductory segment, and then that'll be followed by a conversation between the two of us, and then we'll open this up to a Q&A with our audience. Dr. Saray Stancic is triple board certified in internal medicine, infectious diseases, and lifestyle medicine. She graduated from New Jersey Medical School in 1993 and served in a number of positions in the area of infectious diseases before deciding to dedicate her time to the field of lifestyle medicine. Dr. Stancic's interest in lifestyle medicine is rooted in her personal story of healing, which she'll share with us today. She's the founder of one of the first lifestyle medicine practices in the country and mentors the lifestyle medicine interest group at Rutgers, New Jersey Medical School. She's also the producer of a documentary film that we'll also discuss today. And finally, she's excited to be releasing her first book on October 20th of this year, titled, What's Missing from Medicine? 6 Lifestyle Changes to Overcome Chronic Illness. So welcome, Dr. Stancic.
Thank you so much, Nelson. It is an honor and privilege to be with you today and to be part of this countdown in anticipation of your global Kickstart program. I guess I'd like to begin by simply introducing myself. I have somewhat of a challenging name. So my first name is Saray and my last name is Stancic. Now, I've been a physician for 25 years now, and by training, as you pointed out, I am an internist and an infectious disease specialist. Now, typically, I would have to explain to most audiences what an infectious disease specialist is, but I think we're all familiar in light of this pandemic. We're all familiar with experiences hearing on the news with an infectious disease specialist describing the current pandemic. But this field became of great interest to me because back in the late 80s, early 90s, when I was in medical school in Newark, New Jersey, it was also regrettably coincident with the height of the HIV epidemic. So within that experience, I witnessed unspeakable pain and suffering and human loss, and it was that led to my interest in the field of infectious diseases. Back then, we had 2 wards in Newark of AIDS patients and no treatment. We could only offer them supportive measures and treat the opportunistic infections. And we find ourselves in a similar scenario today where we have this acute infectious novel disease that is filling our hospital beds. We have no treatment, and our only approach is supportive measures. So we have an extraordinary time that we're in the midst of right now, dealing with this COVID pandemic. But I think it's important that we talk a little bit about this, the evidence that we're seeing now in regards to the role that chronic diseases plays in those who are most likely to be hospitalized and succumbing to this disease. Just this past Monday, the CDC put out some surveillance data, which I think is really, really interesting. It showed that those individuals that have a chronic disease at baseline, they were 6 times more likely to end up hospitalized if they were infected with this virus, and 12 times more likely to succumb to it. So this idea that chronic disease, this epidemic that we're living in, has become even more important in the world that we're living in today, as we are poorly prepared to combat this infectious agent. Now, today, my life has taken a turn in that I'm not primarily practicing infectious diseases. I am practicing primarily lifestyle medicine. And so the question I'm often given is, how do you evolve from an infectious disease physician to a passionate advocate of lifestyle medicine? And in order to answer that question effectively, I have to share with you my personal story, which is really the root of why I am doing the work that I'm doing today. And for that, I'm going to take you back to October 11th, 1995. At that time, I was a 3rd-year medical resident, and on this particular day, I was on call in the hospital, so doing a 24-hour shift. And sometime in the middle of that shift, I found an opportunity to take a brief nap. And when I was awakened from that nap to address a patient care issue, I found that I abruptly couldn't feel my legs. When I stepped down to try to get help, it felt as if I was stepping on a bed of hot coals. Next thing I knew, I was in the emergency room undergoing an MRI, and that MRI confirmed a diagnosis of multiple sclerosis. And so that changed really the trajectory of my life. I was no longer that young, healthy physician. I was now a chronic illness patient. and suddenly found myself dependent on multiple medications to slow the progression of the disease, to treat the symptoms of the disease, and to treat the side effects of the medications that I was taking. Within 3 to 4 years of that initial diagnosis, I found myself dependent on a cane or set of crutches, and frankly, depressed and losing hope. And then in 2003 came what I call my aha moment, when by chance I read an article that described a connection between diet and disease. And this was remarkable to me. Here I was an attending physician, and I had never been taught anything about connections between diet and disease. And that article led me to additional publications, namely work done by a physician named Roy Swank, who published an article in 1952 in the New England Journal of Medicine where he described the incidence of MS in Norway. And he noted that the highest rates of MS were occurring in the inner farming communities, in the dairy farming communities, where individuals were consuming large amounts of dairy, animal sources, saturated fat. And Dr. Swank didn't just leave it at hypothesis, he actually started treating patients with a low-fat plant-based diet in the 1950s, ultimately publishing his data on 140 plus patients following them over 34 years. And he found that 95% of his patients were disability-free. This was extraordinary to me to hear this in light of my doctors having told me that within 10 to 20 years, I would likely be in a wheelchair. So in contrast, what Dr. Swank was proposing was striking. And again, as I read more and more of the evidence in the scientific literature, I came to realize that implementing changes in my own life, namely converting to a whole food plant-based diet, might very well offer me some benefit. And so, of course, in 2003, sort of armed with all of this evidence that I had collected, I went to my physician at the time and presented the evidence in hopes that he would support my conclusions, that changing my diet, that changing my lifestyle would offer benefit in regards to better managing my MS. But regrettably, he didn't believe that this would offer any merit. So he advised me to maintain the medications that I was currently taking, the disease-modifying therapies. And I can tell you, Nelson, at that time, in 2003, I was taking a dozen medications and dependent on a cane or a set of crutches. I made the decision at that point to responsibly taper off of all of those medications, and instead I would optimize every aspect of my lifestyle. And so I did that. I converted to a whole food plant-based diet. I began to exercise, something that, believe it or not, in the 1990s was falsely believed to worsen MS. I started to, I learned how to sleep effectively. I was addicted to sleeping pills, hypnotics, whatever my doctors had prescribed, and learning how to come off of those medications, create a healthy sleep environment in my home, and become an excellent sleeper. I learned how to better manage my stress. And what happened, Nelson, and it didn't happen in a week or a month, over time, I noticed that my symptoms dissipated, that I was feeling stronger, that I could stay up longer. I always say I finally could stay up past Jeopardy, which was, to me, a remarkable thing. And on particular days, I would notice I felt confident enough to go into the office without a cane. Over time, long story short, I went from a woman that was dependent on a cane and set of crutches, a pillbox with a dozen drugs, to a woman that crossed the finish line at a marathon. Again, it didn't happen overnight. My journey began in 2003. I crossed the finish line in 2010. It was a 7-year period, but it was a journey that truly changed the course of my life, in that, you know, crossing the finish line at that marathon proved to me that these changes that I had introduced into my life had certainly borne fruit. It had changed the course of my life. I had at one point come to the conclusion that I was going to be a disabled individual and that I would likely be wheelchair bound by the time I was 40 years old. And here I was instead crossing the finish line at a marathon. All of these experiences, in addition to my experiences of practicing medicine and just seeing so much chronic disease, as an infectious disease physician, a consult that I would regularly see would be an infected diabetic foot ulcer in a poorly controlled diabetic. And witnessing these patients struggling with the complications of diabetes, with amputations, and evaluating them in the ICU or after a stroke or a heart attack, knowing I had this body of information available to me that clearly diabetes was a disease that we could largely prevent. I felt compelled to change what I was doing as a healthcare professional. So in 2012, I made another unconventional decision to leave behind my work in infectious diseases, which, by the way, I'm very proud of and was very important. But I felt that I needed to further this idea that prevention should be primary, and that physicians should be skilled in understanding the power that lies in a plant-based diet and in optimal lifestyle, because we know the evidence tells us that we can indeed prevent 80% of chronic disease. And if we have that knowledge understanding today, I think it's immoral and ethical that it is not the primary initiative that healthcare professionals are speaking to. So in 2012, I decided to shift my work to this idea of a lifestyle medicine clinic, and it was going to be my goal to inform the public as best I could through my clinical practice, through lecturing, through writing articles, to relay this all-important therapeutic intervention, and I think importantly also mentoring and teaching medical students and residents so that they too can have this baseline or understanding earlier in their career, so that all physicians, regardless of what subspecialty you pursue, should all have this basic understanding that lifestyle choices are incredibly important and can make all the difference in the world in terms of quality of life for our patients.
That's an amazing story, Saray. Of course, I knew some of that already, but I'm glad that everyone else is getting a chance to hear that. When we released our film, PlantPure Nation, we had the opportunity to go across the country and screen the film and talk to a lot of audiences. And at the end of every presentation, I heard so many stories of people who had MS, who had gotten benefit, just like you did. Mm-hmm. And it's incredible that that the healthcare system isn't standing on the mountaintops and yelling out to everyone to do this, because there is a solution. One thing I'm curious about, this was such a life-changing experience for you. I mean, there's the health aspect, but there's the psychological aspect too. What did you think? What did you feel, having gone to medical school and learned, all that you learned, to discover that this truth was there all along and you didn't know it and your colleagues didn't know about it, but now you've discovered it and it's changed your life? I mean, how did that affect your psychology and, beyond just your physical health?
Yeah, that's a great question. At some point, I think early on, I was angry. I was angry that my medical school had offered me an incomplete education, that there were all these missing parts. I see this medical school experience as this jigsaw puzzle, and all these pieces are missing. So the picture is incomplete. And I was angry, but again, by no fault of their own, that I had one of the leading MS doctors in the country just highly skilled, a leader in the field. And he was incapable of offering me the one bit of advice that changed the course of my life. Again, by no fault of his own, there's this incredible lapse in the medical education model. And even today, we were talking a little bit earlier how if we take the smoking example, how we're so slow to implement these changes. It was in 1963 that the Surgeon General produced the first report that clearly listed all the health issues from smoking tobacco, based on 7,000 studies. And yet it took 30 years for us to remove tobacco smoking from hospitals. It wasn't until 1993 where we removed. So there's this lag. We have all of this evidence. Food is the primary contributor to the chronic diseases that we see today: heart disease, cancer, stroke, diabetes, Alzheimer's disease. The evidence is profound. Yet there's this incredible lag to get this all-important, critically important information to our healthcare professionals. So I think it is very important that we, as physicians who are active in this plant-based realm, active in lifestyle medicine, that we speak loudly and that we bring attention to this lapse. Even the way we train physicians, Nelson, is, I think, inhumane. We ask them to work 24 hours. They have no time to sleep. They have no time to exercise. We have a problem of mental health in medicine. We see high rates of depression and even high rates of suicide. So there are issues here and they need to be addressed. And I think for a long time, we've sort of, brushed them under the rug and are ignoring them. But I think it's time now. I think there's so much excitement in medical schools. I've had this wonderful opportunity to travel across the country and speak at several medical schools, sharing my experience and sharing my work as a lifestyle medicine physician and the film. And the feedback has been so special. I think this new generation, these young physicians are very interested and understand the value that lies in nutrition and lifestyle. And even though they're not getting it in their medical school, they're seeking it out. They're attending conferences like the American College of Lifestyle Medicine or PPOD or other conferences that are speaking on the value of plant-based nutrition and the science of plant-based nutrition. And I think the world is changing. This is an exciting time.
It is an exciting time. I've always told my kids that as dark as it might look, the light always shines brightest when it's dark. And we're living in a time when we're going to see change that prior generations couldn't have even dreamed of. And I really believe that. And, the one thing that's really curious to me about watching people go through this healing process and this process of enlightenment is what it does do to their psychology, which is kind of why I asked that earlier question. We've done a number of these 10-day immersions. We call them Jumpstarts. And that's what we're doing, of course, coming up here soon online. But we've done these in person too. And I've had a chance to watch a lot of people go through that. And it's interesting because it does have a deeper impact on people's psychology when they realize that this powerful idea had been sitting in front of their face their entire lives, but they had no idea because they were so caught in the paradigm of our traditional diet. All of a sudden they begin to look at other issues, other things with a new eye, and they kind of open up to new ideas. And I've even had people change their views of political issues and their political affiliations and all kinds of things. So it's kind of interesting. Of course, more recently we've been living through all of these protests, and I think that there too we've all been caught in a very destructive paradigm. We've had a large segment of our population who've been having some pretty tough circumstances to deal with in all kinds of ways, not just in terms of police but also economic and other social things. And you know, we're just caught in these paradigms, and we never really step outside them to look at things fresh. And when people learn this health truth, I notice that they tend to open up and to do that. But anyways, so you must have very strong feelings, which you've already expressed, about the way that we currently practice medicine. I'm curious, when you talk to your colleagues about this idea, do you find that many of them are receptive to this, or do you still run into resistance?
I can tell you that things are better. Even 5 years ago, in speaking to colleagues, I'm sure there was more resistance. I can tell you that at the medical school, it's been challenging. There's been a lot of obstruction to this idea of lifestyle medicine. But with that said, I've seen a lot of movement. I can give you, for an example, in my practice, I have about 40 patients in my practice that are also doctors. And the way they became my patient was because at one point we had a patient in common, like a poorly controlled diabetic came to see me. We worked on their diet and lifestyle, and guess what? We were able to reverse that diabetes after 15 years. And then they go back to see their endocrinologist or their internist, and the endocrinologist, what did you do? This is amazing. You lost all this weight. You're off of your medicines. Oh, I went to see Dr. Stancic. She's a lifestyle medicine doctor. I'm on this plant-based diet. And then the doctors call me, Nelson. And you know, at first they're skeptical and they're asking me these questions like, what are you doing? And then I share with them. And you know what I do? I say, give me your email address. I'm going to send you the evidence. Why this is the scientific evidence to support this approach. And then I hear back from them and they say, you know what? I think this is fabulous. I want to learn more about it. And actually I want to come see you. And I'm thinking it's a, you know, social visit. We're just going to have a cup of tea as peers, but no, I want to come see you as a patient because I'm pre-diabetic, I'm hypertensive, and I need your help. And that to me has been just a very, very special approach, because when I can help of course, any patient that I see, it's a privilege and honor, but when I have a patient who's also a physician, when I can help them improve their health and well-being, I know it then moving forward, it changes the way that they practice medicine, and it affects their entire panel of patients. So that to me has been wonderful. And I can tell you the other aspect that I've witnessed that has changed in the past decade or so. I'm being asked to speak at a lot of hospitals, ran rounds that where previously I wouldn't have been asked, and they want to learn about plant-based nutrition, and that's been exciting because there's an openness, you know, they're more receptive, and I think we're changing minds. And even when you attend conferences like the American College of Lifestyle Medicine, each year it grows. I remember the first time I went in 2012, I think there were 200 physicians in the room. And last conference, I think there were 2,000. So we're growing, and so it's all good news.
Yeah, and it's happening. I'm glad that you answered it that way, because that's been my experience too, is I'm seeing a lot of physicians who are really because you know, medical students go to school because they want to learn how to heal people. So when they discover that they can do that for real, they get excited about it. But we have come a long ways. I remember, I don't know, I lose track of time, but it might have been as recently as 8 to 10 years ago. My father went to the local hospital. He would go to the local hospital up there in Ithaca, New York, and offered to come speak to the doctors. And so once or twice they organized something, which was a big deal for them to even do that. And he had like 1 or 2 physicians who showed up. It was it was terrible. Here's this man who has this incredible expertise and experience, and no one in the system wanted to listen to him. So it is really gratifying to see what's happening. But now there's another very interesting part to your story, and I very much identify with this because Back in 2013, I had something I wanted to say, and an opportunity came along for me to make a film. I hadn't done it before. I was very lucky in that I met some people who knew how to make movies. But you had a very similar experience. Tell us about your film experience.
Right. So again, you know, when I decided to start this practice in 2012, it was about what could I do to not only see patients and introduce this intervention, but also what could I do to get the word out. So through, you know, speaking engagements and articles, then I saw the idea of a documentary as another avenue to spread this message. So in 2015, we came together and thought about this idea of bringing awareness to this lapse in medical education and helping the audience who viewed this film understand how powerful and important nutrition is. So the film really takes us on this journey, and it's really my personal journey, to present to the audience the overwhelming evidence that we have that points to the power that lies in plant-based nutrition and lifestyle. So the journey actually begins in Ithaca, New York, with your beautiful father, where we had this wonderful opportunity to talk about his vast experience and expertise in nutrition, in the nutrition sciences, and we talk about the China study. And from there, we travel to Connecticut at Yale with David Katz to talk about his work, Dr. Esselstyn at the Cleveland Clinic. And so we take the audience on this journey, and we interwoven between those visits on these, you know, these shoulders on which we stand, these experts. We tell my story, and we tell the stories of a couple of my patients, and we also share and discuss the lapse in medical education. So really, the film seeks to empower and inspire the individual by presenting the overwhelming evidence in the scientific literature, also seeks to bring awareness and change to the medical education model. And so that's my hope, that the film will entertain you and will inspire you to create change.
Yeah, and just so that our viewers know, your film is called Code Blue.
Yes.
And I think we have the trailer that Jesse here is going to play for all of us. So let's take a look at the trailer.
Okay.
We spent $3 trillion last year on what we call healthcare, which is predominantly sick care, 86% of which was treating chronic diseases that can be often prevented or even reversed by making lifestyle changes.
Back in 1995, I was diagnosed with multiple sclerosis. Life literally changed overnight. I was no longer a young, healthy physician. I was now an MS patient, and I myself was admitted to the hospital.
This may be the first generation in which our kids may live a shorter lifespan than their parents.
Heart disease, cancer, stroke, diabetes, dementia, respiratory disease, just a huge swath of humanity is dying prematurely, unnecessarily, every year.
There's so much that we could do to prevent.
We can prevent about 80% of chronic disease through lifestyle changes.
Lifestyle medicine is about diet, about exercise, about stress.
Throughout 4 years of medical school, 4 years of residency, and then 2 years of subspecialty training, none of my educators ever commented on a connection between diet and disease. This was new to me.
There is a severe nutrition deficiency in education.
Let's be honest, a number of medical schools are run by Pharmageddon.
We were just in class and we just memorized 50 different drugs. Oh, this patient's hypertensive, these are the drugs you prescribed. Not once did we talk about, hey, let's modify that patient's diet. Let's try to get them on an exercise program.
This is so common sense. And why aren't the large schools, the Ivy League schools, why are they not looking at this in terms of training a good physician?
Doctors say, I don't want to be a pill factory anymore. I don't want to just be an assembly line of prescriptions. I want to change people's lives.
Every student that comes across lifestyle medicine, they get so motivated. They're like, this is what I want to do.
With lifestyle medicine, we can change the world.
Okay, I wasn't sure, we weren't sure how that was going to stream through Zoom, but it was pretty good. The trailer's fantastic and the movie's fantastic, and I encourage everyone to go check it out. What are your plans for the movie, Saray? Where are you at right now, and what are your plans for it?
Right. Well, right now, the film was released digitally on May 26th. So it's on Vimeo, Amazon, Google Play, Vudu, and Apple TV. And we also released the DVD format about a week ago. Regrettably, that we had planned a theatrical release in Los Angeles, New York, and Pennsylvania, but because of the COVID-19 pandemic, that was unfortunately canceled. So now it's about getting the word out and sharing the film with as many as possible, and hopefully getting it seen at every medical school across the country. I think at this point we've had screenings at about 20 medical schools, and I believe we have somewhere in the range of 170 total in our country. So we have work to do. So it's definitely, I'm reaching out to organizations, healthcare organizations like the AMA, the American Medical Women's Association, in hopes that they will be interested in sharing it with their group. And it's really now word of mouth, and that's why I'm so appreciative to have this opportunity, Nelson, to be with you today and to share the film, and again, in hopes that the film is seen and it leads to inspiration and a want for change, for positive change, for not only ourselves personally, but also to change establishments that are falling short. And there's this wonderful quote that I often use when I speak by Maya Angelou, and it reads, do the best you can until you know better, and when you know better, do better. So there's no shaming or laying blame on the past. But I think that now that we have the evidence and understanding, and we overwhelmingly know, we need to act, we need to do better so that we can assure that future generations have better, quality of life and are able to, I always think back, those 8 years that I suffered, what if I had known about the power that lies in nutrition and lifestyle? Could I have prevented that suffering? And that's really what my hope is to assure that we have this understanding to not only prevent disease, but also to better manage and reduce pain and suffering for humanity.
That's beautiful, Saray. I really like that quote too, because that's something I try to keep in my mind as well. We can only do as well as we know how to do. And a lot of times, because we don't know enough, we make mistakes. And hopefully we have the humility to recognize when we've done that, and then we can make corrections based on what we learned. But that's a really powerful idea. And I also like your attitude of, I think what I'm hearing is not blaming and forgiving, and just not dwelling in the past, but moving forward. And I think that's a good philosophy.
Absolutely.
One last thing, because I'm looking at the clock here. I want to save time for the Q&A. You mentioned up front that you have been involved in treating patients during this COVID crisis. Is there anything more that you wanted to say about that? I can only imagine that you've had a number of experiences. This is very, very personal to you, and that you've been on the front lines here. Anything you want to share?
Well, the current pandemic has really been, I think, has really taken my breath away, to be frank. You know, for years as an infectious disease physician, we were trained on pandemic preparedness. And when I was at the VA early on in my career, thinking through, you know, our experiences with, example, the anthrax scare and smallpox scare and all the preparedness. And when I speak to my colleagues in the field of infectious diseases, what's happened today has really surprised all of us. And I think that it's also important to note that even though this pandemic has been horrific and has turned our life upside down, there are other respiratory viruses that we deal with on a seasonal basis, like influenza. Do you know that recently the CDC shared with us that there have been about 53 million cases of influenza in the 2019-2020 season, and we've had about approximately 60,000 deaths in influenza, and yet no one's really talking about that. So the pandemic itself has been, I think, extraordinary in that it's shown us, as I said earlier, how vulnerable we are because we live with this in the midst of this chronic disease epidemic. It's surfaced for us really how vulnerable we are. When we see, again, that having a chronic disease like heart disease or diabetes or chronic lung disease leads to increasing your likelihood of dying by 12 times. I think that's just that, if anything, I hope that that's the silver lining that we walk away from this pandemic, that we need to address this chronic disease epidemic that we're living in. And hopefully moving forward, again, we know better, we do better, that individuals will understand that it is important that we don't carry that excess weight, that it is important that we eat properly and exercise and address every aspect of our lifestyle to reduce heart disease. Again, heart disease is the #1 cause of death in our country and has been as such for the past 30, 40 years. And so I think that the silver lining, hopefully, in all of this, as we get through this difficult period, is that we bring awareness to a need for each of us individually to change.
I think that's a fantastic way to see it. And I agree with you. Because of this pandemic, I think there's an opportunity for us to be more effective in communicating this message, even if the powers that be don't want to. You know, because it's frustrating to me. Just a week ago, I was on the CDC website and I can't find anything about this on there in their list of recommendations. And, you know, you watch the news and you hear nothing, and the White House press conferences, you don't hear anything about this. So it's really tragic, but thankfully there are a lot of people like you out there helping to spread the message. So
you're right, it's such a missed opportunity because we do have all these press conferences and we have so many experts talking about, yes, of course it's important from an infection control perspective, social distancing, washing your hands, using your hand sanitizer, obviously all of that is important. But the fact that there's no discussion on the role that chronic diseases are playing in mortality and morbidity from this acute novel infection is a missed opportunity. And I hope that more of my colleagues in the field of infectious diseases who are on, you know, these networks talking about COVID-19, that they take a moment and that opportunity to talk about the role that chronic diseases are playing in individuals dying from this infectious disease.
yeah, I agree. Well, let's stop here, Saray, and let's open this up to our audience to ask you a few questions.
Sure.
Yeah.
Great. Thank you, Nelson, and thank you, Saray, for sharing your story. Very inspiring, and I know that many of the people listening today are inspired as well. We have received a lot of questions about multiple sclerosis. So for those who are a little unfamiliar, can you describe what some of the common symptoms are?
Sure. Well, multiple sclerosis, it falls under, is categorized as an autoimmune disease. So essentially, what happens in multiple sclerosis is that your immune system, which is supposed to be protecting you against viruses and bacteria, it starts to attack you, right? So in multiple sclerosis, it actually attacks myelin, which is the fatty sheath that protects the brain and spinal cord. And so when that happens, we have this misfire. Nerve signals from the brain to the body are compromised. And so patients develop symptoms like numbness and tingling. They may have weakness. It can affect your bladder. It can cause blindness, something called optic neuritis. And typically, this is a disease that is largely diagnosed early in women, primarily in their 20s and 30s. This is a disease that is, there's no cure. It is a disease that we manage through immunosuppressive regimens, so disease-modifying therapies. We have about 12 to 15 approved by the FDA now. Back when I was diagnosed, there was only one, so there's been a lot of development in that field. But those drugs don't cure. Their role is to slow the progression of the disease. So that's essentially what multiple sclerosis is.
Great, thank you. And so sort of a follow-up question to that, based on your experience with diet and how it helped with your MS, do you believe that nutrition, and specifically plant-based nutrition, can have an effect on even advanced stages?
Well, let me first say that how does plant-based nutrition affect outcomes in MS? Because we have some recent evidence that helps us to understand that. So back in the 1950s, when Swank said a low-fat plant-based diet was somehow helping, reducing the risk and improving outcomes in MS patients, people couldn't understand how could what you put on your plate affect an autoimmune disease that is attacking your brain and spinal cord. And most recently, there is some evidence to help us understand that connection. So here's what we're finding. When you eat a plant-based diet, so a diet rich in fiber, you change the types of bugs in your gut, which is what we call the microbiome. We have this colony of organisms that lives in our gut, 3 to 5 pounds of bacteria, virus, and fungi. And what happens is you have some bugs in your gut that are good and others that are bad. When you eat a plant-based diet, you feed essentially the good bugs. And the good bugs in turn produce signals, chemical signals, that then communicate with the immune system and tell the immune system to stop attacking myelin. So patients feel better. So there's the connection. What you put on your plate affects your microbiome, and your microbiome then favorably affects your immune system. Isn't that so interesting?
Yeah, that's incredible. Thank you. Yeah, so much for explaining that connection between our gut microbiome.
Now, you did ask about advanced disease, and so we don't have any evidence to effectively answer that question. I can tell you that Roy Swank, in his works, wrote that if you have advanced disease, then it's likely irreversible. So what we want to do is we want to identify patients as early as possible and get them consuming a healthy plant-based diet as early as possible to slow progression and reduce any damage.
Great. All right, thank you. Our next question has to do with plant-based recipes. Do you have any cookbooks that you recommend for people who are just starting out eating this way?
Well, one of my favorite cookbooks, and Nelson knows this, is Kim Campbell's PlantPure Nation cookbook. There's a wonderful recipe in there, the chana masala recipe. That's one of my favorites and my family's favorites. But there are so many. There's Jane and Ann Esselstyn's Prevent and Reverse Heart Disease cookbook that has wonderful recipes. And then there's a lot of great websites like Oh She Glows or a Minimalist Baker. There's so many young chefs who are so creative and have wonderful recipes. And I have many of those on my website, and I'm sure that PlantPure Nation has plenty of recommendations as well.
Great, thank you for answering that. Another question from registration. Have you considered collaborating with Dr. Brooke Goldner a physician known for developing a nutrition-based treatment for her own autoimmune disease, on a documentary or educational summit program on autoimmune diseases?
Yeah, you know, I have never met Dr. Goldner, but we just recently were on a conference together. It was a teleconference, and we introduced ourselves remotely, and I hope to meet up with her in short time and exchange some of our ideas. But that would be wonderful to create another documentary, maybe focus on autoimmune disease. But I'm happy to do that, and I'm really excited about learning more about Dr. Goldner, her story, and her approach.
A good idea for future documentaries. Another question, how do you best boost your immune system during the COVID-19 pandemic?
Right, so all the things that we just talked about, right? Optimizing every aspect of your lifestyle, but your diet is overwhelmingly, I think, the most important aspect of boosting our immune system, right? The majority of us, regrettably, in the United States are consuming the standard American diet, which is pro-inflammatory and damaging to our immune system, right? So the standard American diet is composed primarily of animal sources, of processed foods, and if you look at the percentage of calories that the average American is consuming from plants, it's somewhere around 6 to 10%. So very little of what we're consuming today is ideal. So this is what we need to do. We need to shift the American palate. We need to shift our interests. The world right now, particularly in our country, is animal-centric, right? So typically if I ask someone, what did you eat for dinner? They'll say, I had the chicken, the fish, the steak. Nobody says, I had the asparagus, the sweet potato, the cauliflower, right? So we need to shift the culture so that we start talking that way, so that the plant is the primary component of our plate. When we do that, we will change the world. We will reduce rates of diabetes in our country exploding. When I was in medical school, rates of diabetes about 2%. Today, we're brushing past 10%. And the CDC predicts by 2050, more than a third of us will have diabetes. And that's largely fueled because of our terrible standard American diet. We need to change that.
Yeah, that's exactly what we're trying to do here at PlantPure Communities.
That's why your work is so important.
Another question from registration asked, as a vegan with MS, I'd like to know a little bit more about how you overcame it with diet. Did you focus on eating raw vegan or both cooked and raw?
Both cooked and raw. So, so for the vegan who just wrote in, it's important. The word vegan can be a little bit controversial, right? So I don't like to use the word vegan because you could be vegan and eat a really poor diet, right? You could eat potato chips and drink beer and be vegan. So for me, it's whole food plant-based. It's eating whole foods in their most natural state, reducing processing, which is very, very important. But again, beyond diet, it's important that we also, particularly in autoimmune diseases, that we address all aspects of lifestyle. So it's important for us to maintain an active lifestyle, getting in that physical activity near daily as best you can. It could be hiking, it could be biking, dancing, swimming, whatever you enjoy, but get your body moving every single day, addressing streams of stress. We have so much stress that is coming in every day, and we can't ignore that. There has to be a modality that we utilize to address those streams of stress, and we need to sleep effectively. We need to address substance abuse issues that are truly problematic. Alcohol, smoking, recreational drug use, these are all parameters that I discuss with patients and address. And I think also part of lifestyle medicine is this idea of avoiding social isolation. We're in the midst of this pandemic and we're asking individuals to maintain social distancing, but that doesn't mean social isolation. It's so important for us to maintain those loving relationships with our family and friends. Even if it's a Zoom call like we're having today, it's important for us to have those interactions. Those interactions are medicinal and they're important for our overall health and well-being.
Wonderful reminder. So we have a number of questions related to the film. One of the primary ones was, how can people watch the film? Is it available to watch via DVD? And then also, once people have accessed the film and watched it, how can they use it to help others?
Right, so the film is available on several digital platforms that include Vimeo, Amazon, Google Play, Vudu, and Apple TV. And it is also available by DVD. And I know that there's a little bit of a problem with the DVD. We're having in terms of getting it stocked and delivered. And that is in large part because of COVID-19 and Amazon. But we're getting that straightened out. But if you want to watch the film, you can download it digitally. And as I said, it's available on all those formats. I think whatever you can do, one of the hopes that I have is that the film is shared in groups. One of the things that I really enjoyed was attending screenings with an audience, watching the film with them, and then talking to them about it. We had a screening in Pennsylvania where community in a movie theater, and we had community, we had doctors, we had nurses, we had store owners, restaurant owners, just people in the neighborhood. And it was wonderful to hear the exchanges within that community. What could we do in our zip code to enhance plant-based options, to increase, walking pathways? How do we get a healthier community? And there was even a restaurateur at that screening that offered to add a plant-based option to his menu. So it was wonderful to have that interaction with individuals from that community and all working together to bring change to their part of the world. And that, for me, to witness that was really very exciting. And then also, as I said earlier, I want to get this film before as many healthcare organizations as possible, in medical schools, nursing schools, physical therapy schools, registered dietitians. I want to share this because these are the healthcare professionals that are seeing the patients one-on-one, and I want them to have that understanding. Dr. Sadler, who's a dear friend of mine, who is a cardiologist in Ohio and runs a wonderful organization called Walk with a Doc, he says to me, this is having Code Blue as an option to share with my patients is wonderful, because I can give them this film or advise them to watch it and to help them understand the science behind plant-based nutrition and help them understand the importance of lifestyle. So sharing it in hospitals and to have physicians recommend it to their patients, that's a dream come true.
Excellent. And we are going to move into closing remarks now. Is there anything more that you'd like to share, Dr. Stancic, before we move on to that?
I just want to offer my deepest gratitude for the opportunity to be with all of you this afternoon, and I wish you optimal health and well-being, and know that we can all do this. We can do this for ourselves, we can do it for our communities, and in turn we can change the world.
Great, Nelson, it's over to you now.
Okay. Well, thank you, Dr. Stancic, for coming onto our webinar today. And your story is so inspiring, but what I have learned about you, and I've not just from this conversation, but through others, is you have a very humble and positive philosophy of life. And I really respect the fact that you had this experience and you're out there kind of paying it forward. You're not just sitting on it, but you're doing all you can to help spread this message. So really respect you for that. And we will do all that we can do through PlantPure Communities to raise awareness about your film and your story. And one of the things I'd like to talk to the team about here later, and I think there's already been some discussion, is how we can help promote awareness of your film through our pod network. So
thank you
I'd love for all of our pods to do screenings of your wonderful film. But thank you for coming.
Thank you.
That's great. We will definitely follow up on that. Just a last parting comments. Just again, thank you, Dr. Stancic. So inspirational, your story, the film. And thank you, Nelson, for doing a great job marshaling this, getting this webinar underway and getting all the great information out there. A couple of reminders. The Global Jumpstart is kicking off on this Sunday. We did notice that a few folks who are on the webinar, it looks like that you've signed up, so we're looking forward to seeing you on Sunday. But definitely check it out if you haven't already signed up. Definitely take a look, and it's going to be an extraordinary experience. And then it was mentioned earlier, but enrollment is now open for the Moving Medicine Forward Masterclass in plant-based nutrition. It is definitely clinician to clinician, really getting to some of the issues that Dr. Stancic spoke about today in terms of getting our healthcare professionals more educated about nutrition. But other folks may also be interested in taking the course, so take a look at it. And I think with that, we wish you have a nice day, and we hope to see you on Sunday at our kickoff. Thank you all.